Hi, my name's Daniel. I'm a staff nurse here at Dr. Gray's Elgin, working in theatres in the recovery department.
What does NHS Grampian provide for our local area?
So NHS Grampian provides care for people of all ages, from those that aren't born yet to those in their last few days of life. And this can be carried out in people's own homes, it can be carried out in community hospitals or the acute hospitals such as Dr. Gray's or Aberdeen Royal Infirmary.
Daniel, what does your role entail here at NHS Grampian?
So my role here as a recovery nurse at NHS Grampian is to look after the patient when they initially come out of the procedure. And when patients wake up from their procedure, it can be quite daunting for them. People wake up in many different ways from anaesthetic, but also they can wake up feeling sick, they can wake up in extreme pain, they can wake up feeling perfectly fine. And part of my job is to speak to that patient, reassure them, decide what kind of level of care that they need, and work as a team to resolve that if I can't do that by myself and the problem solving skills that I have. With some of the skills that I have, I can deliver stronger care to patients, and that can be giving medication that's being ordered by the doctors, it can be looking after an airway on that patient, it can be even reading their vital signs in order to distinguish which care they need and speaking to the doctors to decide what needs to be done.
Why is it important for you to have these skills within your role?
It's really important for me to be able to work as part of a team to save lives, which is our ultimate goal here, but also to make a difference to people. It's not all action, and sometimes those that come in looking for help need that, and being able to communicate with those people and to be able to communicate as part of a team to deliver that care to that patient is always key. And knowing that we don't always know everything is also part of recognising people's weaknesses to develop as well. So it's key that we have that to make the best impact on the people that we come across in our day-to-day lives.
If you didn't have these skills, Daniel, would you be able to fulfil your role?
I'd have to say no. Being able to work as a nurse means that I have to communicate with patients, and not only patients, their relatives and other healthcare workers. Being able to work as part of a team is key, and being able to have the confidence to know your weaknesses, your own strengths and limitations is key to delivering that safe and effective care to the patient, which ultimately is what we're here to do. And that might not always be the critically ill patient, that could just be someone looking for help.
Daniel, can you give us an example of when you've had to use your skills out with the recovery department?
So part of what we do here at Dr. Gray's is look after the acutely ill patient in their initial stage, and that can be things from a trauma call or a traffic collision, or through to those that have had cardiac arrests. And part of that is that we have to stabilise them here for further care in other hospitals such as Aberdeen Royal Infirmary or even down to Glasgow or Edinburgh. The trolley that you see behind me is the trolley that we would transfer critically ill patients on, and that falls down to the team here, and it is a team that we work as. The anaesthetic team is initially responsible for looking after that patient after the emergency department. The recovery nurse then helps them with that and works as part of a team to stabilise that patient for further care. But we work as a bigger team, and being able to communicate from people from support workers right the way up to consultants, and not necessarily in our own hospital, needs to happen.
How can you improve on the skills that you already have?
So every day working in healthcare is challenging. We learn things all the time, and we can never know everything in our job. Therefore, we listen to people that have more experience, our mentors. We listen to doctors who have more experience and knowledge in that area, and we learn by going home and learning our weaknesses, which then allows us to develop our confidence in what we do day to day. I learnt my skills through various different things that I did. So I started as a support worker with NHS Grampian and worked my way up to study at university, becoming a staff nurse in May at the start of the COVID pandemic of this year. I also volunteered in the community working with a local charity that enabled me to develop the skills to be able to communicate with patients, which is essential for what we do here at Dr. Gray's.